What about creatine? Okay, everyone's talking about creatine
Yeah.
now. This is so hard to keep up with.
Abby Smith-Ryan is an incredible PhD exercise physiologist who is doing the work on creatine and menopausal women. And it is synergistic with working out. Don't take creatine and think you're going to grow bone. But if you're doing the resistance training, creatine appears to be synergistic with your protein intake.
What is creatine?
So it's a good question. So creatine is a form of an amino acid, a chain, specific chain that we store in higher amounts when we're younger. And our stores drop off with aging and then with menopause as well. And so people who are supplementing, it used to be for bodybuilders or build muscle. Well, when you look at the menopausal women who were doing the resistance training, eating plenty of protein and taking creatine, their gains were higher in strength and in like the volume of their muscle. And so that is always a positive effect. There's no amount of muscle that is too much.
What about collagen?
So yeah, I'm a fan. So you have to ask, why are you taking the collagen? What would the benefits be? So collagen is a form of protein, but it's not complete, meaning it doesn't have all of the amino acids that we need as humans. Okay, so if you eat meat, you'll have all of the amino acids. It's a complete protein. So collagen is one of the incomplete proteins, but it contains most of them. And there's specific studies. So when I was digging around, like how can I help my patients prevent osteoporosis, I found studies that were done on this specific Verisol collagen. Verisol was for skin. It was Fortibone for the bone. And they saw improvements in their osteoporosis, osteopenia, and osteoporosis. And I thought, okay, I'm going to take this. Like this would work for the ladies who are in the nursing homes who already had the disease. I bet it's not going to hurt me, and it's going to help me prevent, because I'm all about prevention. I am not interested in osteoporotic fracture like my mother and my grandmother had.
Right.
Or dementia. So, I'm refusing to accept that as inevitable.
My joints are so sore. Sometimes when I sit for a long time, then I wake up, I get up and I walk around the apartment like this. It's so bad, hello? What can I do about that? Will collagen help? What about glucosamine chondroitin stuff?
So that's been more studied for joint pain, glucosamine chondroitin.
Is that work?
There's pretty good studies showing improvement in joint pain.
Can you come up with something really good for my joints? Because I'm so creaky.
I'll talk to my husband's running the back end of that business for us, so I'll talk to him.